had ADD,
Oh.
and I'm not a doctor.
I think we're live, Bob. We may be live on YouTube now.
Yeah.
Are we live now?
You
Tony,
may just
you
went
ready?
up.
Oh, there we go.
Anyways, the copy cured him or settled him. Thank you.
So good morning. Good morning. We're now live streaming on YouTube. So it's the official start of the Friday morning meeting of the House Appropriations Committee. And we're going to get started as we have several amendments to walk through on the big bill this morning. And we're going to start with Representative Briglin, and welcome, Tim. It's nice to have you here. Teresa, would you put the amendment up on the screen? And if you can, we're having some technical issues. So if not, I hope everyone had the opportunity to print off the amendment. Here we go. Okay, Tim, are you walking through your amendment or did you bring Ledge Council with you?
I'll walk through it, and
Okay.
it's not complicated, and I'll go through some of the specifics of the JFO fiscal note as well.
Okay. You just, for the record, introduce yourself, please.
Sure. So thanks for inviting me to testify, Madam Chair. I'm Representative Tim Briglin from Thetford and the chair of the House Energy and Technology Committee. So the current House budget has $586,000 set aside as a placeholder for H688 in the other bills section. And now that we've passed H688, I'm offering an amendment to the budget as the final technical step in appropriating funds to support the work of that bill. The amendment formally appropriates this $586,000 for 3 positions at the Agency of Natural Resources, along with other expenses, consulting costs, and per diems needed to implement the bill. We discussed this FY21 appropriation and the fiscal note from JFO back in February, and you approved this appropriation as part of the House bill passed at that time. To go to some of the specifics in the fiscal note, to break this appropriation down into essentially 3 different pieces. The first piece, as I mentioned, is for 3 additional FTEs at ANR. 1 FTE is for a staff director for the council set up as part of the bill. The second FTE is for a data analyst with expertise in emissions measurement, verification, and mitigation measures. And the third FTE is essentially for an attorney with regulatory expertise. So that's, of this $586,000 appropriation, that's $336,000. The second piece of this appropriation is for per diems, and that was essentially a calculation of the non-state employees who would be meeting as part of this council getting per diems. And the assumption was that the council would meet 10 times over the course of the fiscal year, and the subcommittees would meet 6 times. I think that added up to just short of $50,000, but this was a round number. I think it was about $49,000. So that's $50,000. And then the third piece of the appropriation is for $200,000 in funds for public outreach and consultant work. Again, working with ANR and JFO and discussing the implementation of this bill, there was a full expectation from ANR that they would bring in some outside expertise to help with some of this work. There's also a number of public meetings that would be part of the council work, as well as some of the rulemaking process. So that's what the third piece is for. And again, that adds up to $586,000. When the Senate took up this bill, they chose to separate the appropriation and the policy. When they passed the bill back in June, they wanted the appropriation to go through the full year FY21 budget process. So my amendment would appropriate these set aside funds for the specific purposes outlined in the amendment and that I just mentioned. So that's essentially the background of the amendment, and would ask for the committee's support. Thank you.
Thank you, Tim. Teresa, it's a short amendment. I think maybe many have the opportunity to print it off. So thank you. We're back to our full screen. Are there questions for the representative?
And Kitty, I beg your pardon. I'll just
Sure.
mention that the JFO fiscal note that I mentioned was, that fiscal note was put out by JFO back in February. That wasn't something that was done in the last week. So just want to be clear on that.
Thank you, Tim, for that clarification. This was the original bill passed our House, as Tim mentioned, back in February. Questions for Tim on his amendment? Maida?
Just to double check, thank you, Madam Chair. Just to double check, with regard to the fiscal note, is it anticipated with your committee, Tim, that the figures here as it relates to the 3 additional FTEs at ANR, that any impact coming from the Pay Act, which has gone into effect since last February, it fits still within the numbers we've got here?
I'm going to need help there. Again, the figures that were come up with here were, I think kind of a conversation between ANR and JFO for what these 3 positions were. So I can't tell you. I'm sorry.
Okay. Thanks.
Are there other questions for Tim? Marty?
Yes, good morning, Tim.
Hey,
I
Marty.
realize we're talking about the morning. We're talking about the funds for this particular fiscal year, but as I recall, in the bill, is it intended that these 3 positions continue for next year as well?
Yeah, no, thanks for
If
bringing
there's
that up.
sufficient funding?
Yep. So I'm going to get a little out of my budgetary understanding comfort zone here. The original appropriation that you had approved back in February was a 2-year appropriation, and it envisioned funding for these 3 positions for FY22 as well. Frankly, that was confusing to me at the time. It wasn't clear how we appropriate, for 2 years. This appropriation is for 1 year. But to get to the specifics of your question, yes, it is anticipated that the utility of these 3 positions would be necessary for 2 years. So I'm anticipating that in FY22, there will need to be an appropriation just for the 3 positions, not the $200,000 of consultant and other expenses. So again, looking ahead to FY22, the appropriation wouldn't be $586,000. It would be that less the $200,000 is what I'd anticipate. And I think that's what was in the original appropriation back in February.
Correct.
And I know we're obviously later than you had originally projected to get this bill passed. Is there an idea of when this work might begin, when these persons might be hired?
Yeah, that's another good question. So I would say that there's a 3-month delay. So it's not, it's, as fiscal years go, there's a 3-month delay. I think the anticipation originally was that this work would start on September 30th. I think that's what the initial anticipation was. So now I think the expectation is that this work will start on January 1st. What the bill highlights is when it becomes law, if it becomes law, but when it becomes law, the council must be appointed within 60 days of becoming law. So let's say this becomes law on September 30th. Then the council must be fully populated by December 1st. And then the work of the council must begin within 30 days of that time. So we're talking January 1st. So again, short answer to your question, I would say we're probably 3 months behind where we probably thought we were going to be when we, were initially going through this process back in February and March.
Okay, thanks.
Thank you,
Thank
Marty.
you, Marty. Are there other questions?
Kitty, I can't raise my hand,
Oh,
but
Mary?
thank you. When we were talking about this, the sums of money that we needed to reserve last week, my recollection is we reserved funds for the Global Warming Solutions Act for the first and second years. So we have set aside those monies for, am I wrong, Marty?
In the original bill, we did set aside for the 2 years when we would move forward with the restatement bill, with this restated budget. What was reflected was the first year amount
was
of
the full first
584.
year. Yeah, thank you.
The full first year.
Thanks.
Are there other questions for Tim? I don't see any other questions. Is the committee ready to take a vote on this amendment? Has the clerk prepared the roll call, and I would entertain a motion?
Thank you, Madam Chair. I would like to make a motion that we report favorably on the amendment presented by the representative from Thetford.
And is there a second?
Second.
Thank you, Mary. So the motion has been made and seconded to accept the amendment from the representative from Thetford. Is there any further discussion or questions or thoughts before we take the roll? If not, the clerk, would you please call the roll?
Thank you. Representative Conquest.
Yes.
Representative Fagan.
No.
Representative Feltus.
No,
Representative Helm.
Bob, you're muted.
I'm sorry. No.
Representative Hooper.
Yes.
Representative Jessup.
Yes.
Representative Lanford. Yes. Representative Myers.
No.
Representative Townsend.
Yes.
Representative Iacovone.
Yes.
Representative Toll.
Yes.
That is 7-4, Madam Chair.
Thank you, Diane. And as we did back in February, Maida, you reported out our position on that bill, and you'll report out this amendment. And Teresa, you will follow up with the clerk and with Maida to make sure the clerk's office, we don't have to do that. All we simply have to do is report it out on the floor. Okay, Maida, you're set to do that.
Okay, thank you.
Okay, we are going to move to Representative Harrison. Welcome. It's nice to see you. You brought the only levity there was to the budget yesterday. We appreciate that. Would you like to introduce yourself for the record and present your amendment, please? Oh, and excuse me, Tim, thank you. And you don't need to stay. We'll see you on the floor.
Thank you. Thanks, everybody.
Thank you, Madam Chair. For the record, I am Jim Harrison, representative from Chittenden. And I hope my amendment goes a little smoother than the last amendment. I think it's pretty non-controversial. If you remember back when I was before you in February, and I apologize for not looking at the language closer Monday night, but our emergency director locally is very frugal, and she was able to purchase some sirens that were used in the Vermont Yankee plant that are no longer being used or needed. So we have the sirens, and what the funds were intended for, the request was to provide for installation help. I don't know if I mentioned it, but the manufacturer of the sirens, American Signal, is in Wisconsin, and they would need to send people to Vermont to help with the installation. So the amendment very simply strikes out to purchase a warning siren and inserting instead for installation of one or more warning sirens. We actually have one that's already installed that wasn't adequate, but we have 3 more to install, which hopefully will do the job. Thank you.
Thank you. Teresa, can we go back to a full screen? Thank you. Are there questions for Representative Harrison? If there are no questions, it's pretty self-explanatory. I would entertain a motion.
Madam Chair, I'd like to move that we report favorably on Representative Harrison of Chittenden's amendment to H 969.
Thank you,
Second.
Diane. Thank you, Peter. The motion has been made and seconded to accept the amendment as offered by Representative Harrison. Are there any final questions? Chip?
Yeah, Jim, does the town have or the towns have a estimate of what it costs to do the installation rather than the purchase?
I'm sorry, could you repeat that?
Yeah, do the towns have an estimate of what it costs to do the installation rather than the purchase, which is what we're changing it?
Sure. They expect it to be in excess of $10,000. I don't have the exact figure of the estimate of having American Signal technicians come from Wisconsin. The town has also set aside some money. We've also passed a hat to Pittsford. Not sure if we were successful in getting a donation, but it could be between at least between 10 and 20,000. This also takes into consideration some in-kind help from Green Mountain Power with connecting it to the system. So I apologize if I don't have an exact quote, but it's comfortably going to be above $10,000.
And that's kind of, I would expect that if you're bringing somebody in to do it, and I just want to make sure of that.
Just for reference, a couple of years ago, the town installed one siren, which was a total of purchased and installed a siren. It was about $42,000, which was largely paid through with a FEMA grant. We're not, we cannot apply for that same FEMA grant again, I guess, the way the grant guidelines work.
Great. I just wanted to make sure that the town has some skin in the game here, and it sounds like you definitely do. And thanks for that.
Thank you, Chip. Are there any other questions? Bob?
Yeah, Jim, what triggers this alarm to go off?
A breach of the dam. There are monitors.
I get it, but
in the dam.
okay. Okay, so there is electronic, it doesn't have to be a person pushing a button, an electronic piece of equipment.
Yeah, you're right.
detects it.
There's not a person at the dam 24/7 on the lookout. This is automatic.
Well, I assume so, but I thought I might want to ask.
Yeah, and just as a reminder, the likelihood of a breach is very small. However, there is a known fault line and next door Mendon. So it is possible we could get an earthquake of some magnitude, and that would likely cause a problem for the dam.
Well, and that dam comes right into Rutland. Once it gets done with Rutland, it heads for Castleton and Fairhaven and right down the Castleton River. And that's in my backyard, by the way.
Yeah,
So,
I don't
yeah,
think the
thank you.
sirens will reach Castleton, but
They won't?
we'll give you a shout. So,
Yeah, give me a call then.
yeah.
Thank you.
Thank you, Bob. Thank you, Jim. Any other questions before the clerk calls the roll? If not, Diane, would you call the roll, please?
Thank you, Madam Chair. Representative Conquest,
Yes.
Representative Fagan,
Yes.
Representative Feltus,
Yes.
Representative Helm,
Yes.
Representative Hooper,
Yes.
Representative Jessup,
Yes.
Representative Lanfer, yes. Representative Myers,
Yes.
Representative Townsend,
Yes.
Representative Yakavoni,
Yes.
Representative Toll.
Yes.
Who's reporting this, Madam Chair? Or
I believe this is Linda's.
Yep.
Thank you, Linda. And Jim, thank you for coming in. I'm glad
Can
we
I,
could.
Thank
can I
you.
make,
And-
Can
and
I
thank
make
you
a
for your
last-
support.
Bob?
can I make a last comment?
Sure.
This is something that's for 25 years has been talked about. There are a lot of dams out there that are in question, some privately owned, and yeah, it's just a mishmash of everything. My point is, when we've always looked at trying to fund them, this is the first one as I can remember that we've actually put some funds into. It's an important one because it sits right over the top of a city, but my point here is there are many, many other dam issues out there to be addressed over time, I guess. That's all I wanted to say. Thank you.
Thank you, Bob.
this is where Mary comes in and says Bob's turned into a spending liberal.
Jim, thank you for coming in. You're welcome to stay, but if you have other places to be, we'll see you on the floor at 2. And next we have an amendment from Representative Higley. Welcome, Mark. It's good to see you. Teresa.
Good morning. Good morning, committee.
Good morning. Teresa, can we put up the
We don't
Higley?
have an official amendment yet, but they are in the process of drafting it in JFO.
Okay, Mark, while we're waiting for the official draft of the amendment to show up from the Joint Fiscal Office, I think that you could give us, are you comfortable giving us a verbal walkthrough of the amendment? Or do you want
Sure. Yeah.
the council?
Yeah, I'd be glad to.
Okay,
Again, Representative Mark Higley from Lowell, speaking to an amendment to basically remove the $400,000 figure from Section B 1105 on the rental housing registry. As you heard on the floor yesterday, even from a committee member regarding this registry, it doesn't sound like there was an actual formal vote to put this out there for this registry. If I could, I'd just like to go over a number of issues that are a concern to me. Even the chair of General Housing and Military Affairs, when he spoke, talked about how, well, we'll set up the registry now and we'll create a bill around policy later on. And that to me is not good policy. This has been in the works for a number of years. I remember whether it was 8 or 10 years ago, this almost made it through. There was a provision where listers were going to be the ones that were going to keep this registry. And as a lister, that to me was a real concern around, it's a hard enough job to keep the grand list fair and equitable across the board without going into people's homes and asking them whether that's in a mother-in-law apartment or what it is. I guess that's another question I've got is what about the ongoing funding for this? Who's actually going to keep this information updated? It's something that has to be updated yearly. I think it's important, like I said on the floor yesterday, that landlords and folks that have these rental units know upfront what the reason is for this registry. All that was expressed on the floor yesterday was that, well, maybe during another Hurricane Irene type event or whatever, we'll know and have access to housing for some folks. But again, back when it was discussed years ago, the Attorney General's office was eager to have this information for all kinds of compliance issues. And I think it's important for the folks out there to realize that. Another reason is, I know even in town here, a number of folks that have rental properties within their homes or attached to their homes, after a few years sometimes have removed that. And I'm sure this isn't the only reason, but one of the reasons is, of course, they have to, through their taxes, take out a certain percent for what that income property brings in, and they pay the non-residential tax on a percentage of their homestead. So again, I'd even like to say that I think the Agency of Digital Services was mentioned as well in our committee, Energy and Technology. We did take testimony from them, ADS, on the UI issue that was mentioned yesterday as well. We took testimony on the transportation DMV, looking at a new policy around inspection stickers and the $1.2 million that the ADS would have to come up with to create a new program for inspection stickers. But we never heard anything about this rental housing registry, and I'm not even sure if that would go through ADS, but that was mentioned. So I know the tax department isn't keen on giving out any information for this. So I guess that's about it as far as concerns go. But again, I don't think it's ready for prime time, and I don't think it's legit to create a registry and not let folks know how they're going to use the registry.
Thank you, Mark. Are there questions from the committee regarding this amendment? Kimberly?
Yeah, I just want to comment. It's not so much a question. This just sort of strikes me as a kind of chicken and egg thing with the money and the policy. Not always traveling in exact time, and that my inclination would be to support the amendment, and that if the Committee of Jurisdiction goes ahead and passes their bill and finishes their work, then we have the dollars, my understanding is set aside in the placeholder status, and we could pull those back up. Is that correct?
This amendment would strike the entire section of the policy and the money. At this time, that money would drop to the bottom line and the budget goes to the Senate. And when it comes back, if the policy moves, then we will have had that money that we had not addressed, and then it would be a negotiation with the Senate.
I think that, from what it's worth, my opinion is that makes sense. Thank you.
Thank you, Kimberly. Marty, and then Dave.
Well, I was just looking for clarification because I looked at our last draft and we had struck two sections of 1105, but we did leave the section to reallocate some money to ACCD to create this registry. So it is there, obviously. I would agree with Kimberly. It seems like we don't have the policy to go with the money, and these are CRF funds that need to be expended right away. and I would agree with Mark. I did not have any discussion at all with ADS regarding this. This is the first I heard on the floor yesterday that ADS might be responsible for putting this together. Not that I doubt they can't do it, but it's a short time period and they have plenty of other things to do between now and December to use CRF money as well. So I would be inclined to agree with the deletion.
Thank you, Marty. Dave?
Yes, thank you. I'm not sure the exact wording of the amendment. Hopefully it doesn't remove any money, but rather just removes our language. Because, and if I can, you all may know this, but this is my understanding. When we passed Act 137 in June, we explicitly gave permission to the Department of Housing and Community Development to decide after September 15th. They didn't have to do it on the 15th, but after the 15th, when they did an assessment of all their CRF spending, to decide how to reallocate it. So we would leave that money there because they may reallocate it to the rental arrearage program. They may reallocate it in a number of different ways. So I don't think it's our intent to remove the money, but rather to remove the language. Now, having said that, and I want to make sure Representative Higley's aware of this, because should it happen, I didn't want him to be upset or anything. It's conceivable that the department and the commissioner and the stakeholders, because it mentions he or she will meet with the recipients of the spending, they may decide to do the registry. And in order to do that, it would have to go through ADS. And as I mentioned yesterday, that's quite ambitious. Doesn't mean that ADS will necessarily database, but as we know, that kind of work has to be approved by ADS. And if it didn't, anyways, and they may decide not to do the registry. So I don't want to be too confusing. I wouldn't remove the money. I just would remove the language. And then that way, the chair of our housing committee or any other members certainly could meet with the Department of Housing and Community Development and have a conversation then about the registry, whether it should or shouldn't proceed. And I did want to point out, Madam Chair, just so that you're aware, Representative Gonzalez is here, who's a member of that committee. Thank you.
Thank you, Dave. By removing the section, Dave, where the money is mentioned, the money would remain as it's appropriated
Where it is, yeah.
CCD, and the Joint Fiscal Office is here if we want to make certain of that, because this was a provision within appropriated money that would be allowed for this use. And if this isn't happening, my understanding is it would not remove the money from where it is appropriated at this time. And I would just check.
Thank you.
Steve
Thank
Klein
you
to make
for that
sure I'm
clarification.
correct.
That's my
I'm
understanding.
correct with that. We have Chip.
Thank you, Madam Chair. It's been interesting to listen to this discussion. I find myself agreeing. So I want to say that the concept of creating a registry in order to be able to provide information to address the concerns that state government as a whole is trying to address in terms of how we serve homeless people, people who are in need of shelter for whatever reasons, makes sense to me. But I think Mark has brought up some reasonable concerns, or at least they seem reasonable to me, about what other things might that registry be used for, what's the specific policy behind creating a registry, and how do we make sure that that it is, that if we fund it and it's created, that it's serving the purposes that we want it to serve, but is also limited to the purposes that we want it to serve. So you know, at the moment, since there's not policy really attached to this funding, I think, as the chair said, waiting to see if there is policy and money together coming back from the Senate makes sense. And so, you know, once we've seen the amendment, if it does what we've been talking about, I'm inclined to support it.
Thank you. We do have Representative Gonzalez here. Welcome, Deanna. Good to see you. If there are questions regarding the Committee of Jurisdiction or if any clarification is needed.
I'm glad to answer any questions.
Do any committee members have
No, I don't.
for either Representative Gonzalez or Representative Higley? If not, I would entertain a motion on this amendment. Representative Lanfer?
I'd love, do we need to wait to have it?
Oh, we need to
Yeah,
wait for
we
the
don't
amendment.
have-
We haven't seen
yeah.
it. Mark, we have to
Right.
wait for the official amendment. I thought it was, we'd already viewed it on the screen and come back to discussion. So
Okay, yeah.
Teresa, do we have that amendment yet?
So drafting ops is just doing their final edits and then they'll send it to Representative Higley for sign off before. I
Okay.
do it. Mhm.
Okay,
we
so
have
I'll
a-
wait for that. I'll wait for that and sign off and get it right back to you folks. Is that what you'd like?
Please. And we're going to move, Mark, if you don't mind, we're going to move on to another amendment from Representative Donahue. You're welcome to stay, or you can sign out and sign back in. And Deanna, the same for you, if you'd like to stay for the vote, or you're welcome to stay or leave. So Anne,
Okay,
welcome.
thank you.
Thank you.
Thank you, Mark. We'll see both of you in a few minutes. Representative Donahue, good to see you. And is your amendment ready at this time? Do we have it up? We can pull it up on the screen. Excellent.
Yes, so this is from the House Healthcare Committee, to be clear, and I've
Thank
sent
you.
it to the entire committee. There's a memo and an amendment. And I have those ready to show.
I can give a quick
Committee or from
overview.
all members, Teresa?
My
Is it-
understanding was at the committee, but I will let Representative Donahue.
Okay,
I believe
Well,
it's.
and before we put it up even,
go ahead, Ann. And if you would just, would you?
Representative Ann Donahue from the House Healthcare Committee. And I did want to give a quick background because several members of your committee have been involved in this, but I think many have not. So this is an amendment, you know, as required by the process, we can't offer a committee amendment. So it's under my name, but it is from the House Healthcare Committee. The department, as I think you know, on the large scale, the Department of Public Safety had provided a memo about a portion of their budget for mental health crisis intervention staff. And we were incredibly appreciative and pleased to see that commitment from the department, from the administration, for really this very, very critical expansion of efforts, knowing the amount of law enforcement time that's right now being forced to be used for interventions that often really are better served by mental health professionals. So we're very appreciative. There also was sort of a sense or presentation that this was just an expansion of an existing program. Actually, there are a number of models of what's being done around the state that really evolve very organically, starting 10 years or more in some areas, and then with multiple iterations. So this is really the first time that there's been a significant proposal and legislative budget item that brings this to the forefront. So we did feel that there were some significant policy issues involving this, and we appreciate the Appropriations Committee using some placeholder language and allowing us some time to dig in deeper into those policy issues. We were able to rush into having 3 hearings. We heard from a total, I think, of 17 different folks, including all of the key administration representatives from law enforcement, from the 7 different designated agency representatives and program directors, people with lived experience, advocates, the Human Rights Commissioner. So we were able to do somewhat rushed and maybe not as much as we would have ideally liked, but to feel like we got a very good cross section of input. We weren't doing a bill, obviously, or we might have included a number of different aspects. And so we thought it might be helpful if we did a memorandum that would be some of the things that might have been in a longer bill that would express our committee intent and how we got to our conclusions and our recommendations. So I think we can look through the memorandum first so that you have that background, and then go to the amendment that would replace the placeholder language.
Okay, Teresa.
So now I'm ready
Thank you.
for the memo.
There we go. Okay, and do you walk through this?
So the introduction is basically what I just indicated. But I think the overarching message is the recognition that mental health crises are healthcare issues, and our final conclusion supporting the placeholder language that this really should be happening through the Department of Mental Health. So the principles, beginning with number 1, is just stating that clearly. Mental health is a part of healthcare. It's not a component of the criminal justice system. We recognize that the emergency responses do sometimes need to include public safety service needs, but they should, actually that's a mistake with the not, we'll correct that, that these responses should be considered part of the overarching framework of mental health care rather than the overall framework of centered on public safety. The second principle, we can scroll here, is a recognition that all of healthcare needs to focus on primary care and prevention. That's what we know avoids the occurrence of more serious conditions and emergencies. And we think it's a really important reminder to underscore that we know that our mental health care services in the state are not wholly inadequate. In terms of promoting health. And that's a root cause of emergencies that result. So we know that we need to keep building a much more robust community services system to support mental health needs, including those components that are needs and support needs within both the criminal justice system and our educational systems. The third point is that there's a real need for a more cohesive framework for emergency responses. And that relates to the fact that we have these many different models that have been developed organically. They're funded through very different funding streams in different communities. And some parts of the state have been able to access funding streams, others have not. So we really think there needs to be a development of a more cohesive framework that makes it more equitable. We really heard a lot of testimony that the triage at the front end, when a call comes into 911, because that's the number people know, whether or not it's really an emergency in the moment. So that front end triage between 911, the designated agency crisis lines, and other emergency call sources, warm lines, and so forth, that really needs to be worked through as part of this broader framework. And peer support services need to be a strong component of that. The funding sources need evaluation. But ultimately, we recognize that this conceptual work to reimagine emergency services across the state for mental health crises can't be completed in the time frame in front of us. It needs to be an ongoing agenda and ongoing work. The fourth point is really the issue of who needs to be at the table. The Department of Mental Health needs to coordinate this ongoing work and discussion, but we think it's really essential that people with lived experience of mental health conditions be actively involved, which did not happen in terms of the immediate budget item that was brought forth by the Department of Public Service. And we heard a lot of testimony about communities with marginalization or inequities, issues like systemic racism that overlay mental health conditions and significantly enhance the risks from unnecessary interventions. So people of color who are also perceived to be having a mental health crisis are very substantially at enhanced risk of the risks that are already inherent when there's a response to a mental health crisis. So we think it's really important that those voices be at the table. From what we heard from the Human Rights Commission and its involvement, that may be a helpful source. And it also needs to ensure that it's consistent with the Mental Health Integration Council that has just been put into place by the General Assembly as part of the 10-year vision for the Department of Mental Health, that it addresses both children and adult emergency services, and that there's collaboration with all the branches of law enforcement, sheriffs, local police, state police, the designated and special service agencies, the hospital system, the education system, and communities themselves. But the final point, we obviously have an immediate need to enhance what's happening right now, to provide safe and appropriate crisis responses that reduce law enforcement involvement when those supports aren't necessary, and that ensure very strong coordination when they are necessary. Because we know that law enforcement is forced right now to take a significant amount of its resources responding to crises that draw officers away from their core duties when they're not best equipped for those responses. So that is the lead in to our proposed amendment, which is not as detailed as some of these underlying issues. So now we get to the language.
And here's the amendment. Okay, thank you.
Yeah, this is the amendment. So if we can
Are
scroll.
you walking through the amendment or is council?
Excuse me?
Anne, are you going to walk through the amendment or is legislative council walking through?
Is Katie with us?
I did not ask her to be here.
Well, and that was my omission. I did not think of that either. We were kind of juggling a lot rapidly, and I think I can walk through it, and maybe we can get Katie here if you have further questions.
Okay, so let's start with you, Anne, please.
Okay, so if we scroll so that we see all of A1. This is similar, or most of it there. This is similar to the placeholder language. It expands on it a little bit, uses some of our more standard language from existing definitions and so forth. But it is an appropriation to the Department of Mental Health for collaboration with the Department of Public Safety and other stakeholders. And here we add a bit more clarity about the important voice of individuals with a lived experience of a mental health condition or psychiatric disability That's drawn from our existing statutory definition. And those whose identities cause them to experience additional marginalization. And that's that reference to those additional communities whose voices have not always been included. In expanding regional models that strengthen partnerships between law enforcement, mental health, and social services through clinical staff positions that address crisis response to mental health emergencies. That phrase and some subsequent language draws directly from the Department of Public Safety memo. We thought it's really important to make clear that the initiative they're describing, the scope of what they want to address, is exactly the same scope that we think does in fact need to be addressed. So this is explicitly for clinical staff positions. It's not to just go into a broader budget that looks at all sorts of possible enhancements to the system. So we go on that the purpose of the program is to enhance the ability statewide to provide safe, appropriate crisis responses that reduce involvement of law enforcement when those supports are not necessary for public safety, and that ensure strong coordination when those are necessary. We can just do the final scroll there for the rest of that sentence. There we are. And supports for and improve access to service and supports for individuals with mental health needs in the community. And again, that phrase is directly from the DPS memo. So if we go on to A2. Thank you. This second piece has to do with the use of peer supports. And again, this was a consistent theme across all of the testimony, including the Department of Mental Health. To the extent possible, in hiring individuals to carry out the purposes of this section, the designated and specialized service agencies who are the ones in the DPS proposal that actually would be providing the services shall give priority to qualified individuals with lived experience of mental illness. Part B is simply a status report back. It's not a report about completed implementation, but simply a status report to the Health Reform Oversight Committee and the Joint Legislative Justice Oversight Committee by November 15th on where the plans for implementing the program stand. And we added a couple of specific pieces that we felt were important to that status report to understand where things stood and whether they were in line with expectations. So those are the four components.
Excuse
The first
me, Ann?
is, yes.
You're more than welcome to continue. I just wanted to let you know that Legislative Counsel has joined the meeting. So Katie is here if you would like her to take over, but if you're doing a great job, you choose. This is your presentation.
Thanks. I might as well finish up and then Katie can augment or answer questions about.
Okay,
the
thank you.
So those 4 points are the memoranda of understanding with the designated and specialized service agencies. This is a three-part, three-component. It's the Department of Public Safety, the Department of Mental Health, and the designated agencies. That's in the original proposal. We're not changing that. There is the development of a memorandum of understanding that has been intended from the start. This is changing who coordinates that development, but it's not changing that structure. Second, the partners and stakeholders who were involved and are involved at that point in planning. The geographic locations identified, and that's to know where that new coverage is going to occur. And finally, the physical location for the planned services, just so that the legislature knows how the development of that planning has occurred. There's been a lot of discussion about the pros and cons of physical location being actually at police barracks or police stations versus at a separate office, but collaborating with. Part C. if we scroll up a
scroll?
little, there we go. Is a reference to that broader look. And this is not a time specific, thou shalt in 1 year or 2 years, but it's a directive about continuing this effort. So it's asking the Department of Mental Health to coordinate the further development of a cohesive statewide approach to mental health emergencies and emergency calls under leadership of the impacted communities, and in collaboration with the Department of Public Safety, designated and specialized service agencies, and the Department of Mental Health standing committees on, and we can scroll there, adult and children's mental health. Those are statutory existing committees that are advisory to the commissioner. The approach shall be consistent with the department's 10-year vision. That's what the Integration Council is working on that we established just recently. And then secondly, on or before March 15th, the department shall report its progress on developing that approach to the House Committee on Healthcare and the Senate Committee on Health and Welfare. Again, that's not an expectation that there be any completed project or program or any particular stage of progress, but just to let us know what its progress is at that point.
Thank you, Ann. Are there questions for Ann, or Katie has joined us if there's questions for Katie? Chip and then Peter.
Thank you. I have a question about, first, I just want to say that that memo is hugely helpful to me. I really appreciate the sort of detailed explanation of the reasoning behind the policy that you're trying to get passed in the budget here. So thank you for that. But in the first section, I'm just a little unclear, and so maybe we could go back to it, or you can just tell me. But that in the first section, there's talk about consultation, working in consultation, and then there's something about clinical staff positions, which I assume is what the folks you're talking about hiring. But I missed sort of the connection about exactly what those clinical staff, where they would be, and what their specific role is.
Yes, thank you. This is because we wanted to ensure that the money goes to what the Department of Public Safety articulated and that we all agree is the need. And the Department of Public Safety was not proposing adding new state troopers who had mental health experience. They were proposing a memorandum of understanding which brought designated agency clinical staff as partners. And so we wanted to ensure that we were referencing those clinical staff as being what the appropriation is intended to fund. That the model will be developed in the manner that's described, the Department of Mental Health collaborating with all of the stakeholders in identifying exactly what will be in those memorandum of understanding, how it will function. But we just wanted to ensure that the intent remained clear, that it's about clinical positions that support law enforcement responses.
And those would be new positions, new people hired?
Those would be, as in the Department of Public Service proposal, those would be individuals hired by the designated agencies working with the police. So this was money that the Department of Public Safety identified within its budget. It's not new money, but it's money that they identified through other savings, and it was intended in the Department of Public Safety proposal to be used for designated agency staff positions. And that remains the intent, that it be those clinical positions.
Great, that's perfect. That seems to make sense. And
Thank you, Chip. Peter and then Dave.
So thank you. And Ann, thank you for bringing this in, and thanks to the whole healthcare committee. This is more of a comment of support than anything else. I've met with the Commissioner of Mental Health for the past couple of years. We have been attempting at their urging to set up a similar pilot in the city of Rutland because the city of Rutland has a disproportionate number of youngsters that ends up in the emergency room due to mental health episodes at home, in lieu of being able to de-escalate it and keep the child at home instead of ending up in the emergency room. We're committed, both of us, both the commissioner and I are committed to continue to try to get that into the budget. And this I see as a, as another step along the parallel step along the same concept. I think this is a very good idea, and I want to thank the committee for bringing it in.
Thank you for, making that point, reminding us back in February, our committee looked at, your committee looked at budget proposals around a pilot in Rutland that was specific for children. And in addition, we were looking at a Bennington project that diverted children from the emergency room. That was why we included that language about children. Children's services being a part of what we're looking at, and as part of that long-term development, not these initial additional positions from the DAs.
Great step in the right direction. Thank you.
Thank you, Peter and Ann, for that explanation. Dave?
Yes, thank you. And I'm supportive of this too. Ann, a couple of quick questions though. Has this work been occurring, or are we starting at ground zero? Have these two departments been collaborating in this fashion already?
They have indeed. And this was my reference to, sort of organic development at different places around the state, but all of those have been collaborative efforts. It's just they haven't necessarily been consistent. Some have had partial funding from communities, Department of Mental Health. So there's been collaboration in all of the efforts. Some have been local, so it's not the Department of Public Safety, but rather, local police departments. But we support and want to continue to enhance that strong collaboration in all of these efforts. Some of the
reason I ask is I'm concerned. Thank you. The reason I'm asking is the November 15th date struck me as being, want to be diplomatic, overly ambitious. These departments are going 110 miles an hour and their plates are more than full. And my concern is that you'll get little more than we're working on it and we're pulling it together. That's all. And I thought you might get more in the March report that you asked for. But you're in a better position than I am to know whether that will be fruitful. It struck me as being an ambitious date. That's all. But that's
no, thank you. That's why we wanted to stress that it would just be a status of where things stood at that point. But because they've already have this work underway in terms of developing the program, and that there are existing models, I think they will have a reasonably significant update on where it stands at that point.
Thank you, Dave.
Sure. Thank you.
Kimberly?
Well, thank you. So Representative Donahue, I just want to really applaud you and your colleagues on the committee work on this. You and I have been having discussions for a long time now about the importance of this. And here in Central Vermont, as all of us know, there have been 2 tragic deaths that relate to some of the circumstances that you're describing this morning. And the other comment I just wanted to make before I go to my question is, I really also appreciate the fact that you touched upon the 911 piece. That seems really important. And in my own mind, again, without the expertise that all of you bring to this issue, I'm just reminded, and maybe this is a false comparison, of the hub and spoke method that people developed to deal with the opioid crisis when the model that was in place just wasn't yielding the results. And so I have high hopes that there will be good work done, and maybe we'll find a very interesting way to move forward and to see some changes in terms of outcomes. But my
Yes,
question is, I'm sorry, go ahead.
I was just going to say, we agree and recognize this is a much more complicated issue to work towards resolving, but it became very clear very rapidly that it's an important issue to dig deeper into.
Yeah. The only question I would just put out there is that anytime that I've attended legislative events that have been hosted by Washington County Mental Health, which is, you know, my area's DA, that there's been this overwhelming emphasis on lack of staff availability, even when positions are recruited for, and people, the turnover is tremendous, the dollars aren't there. And I know we've discussed in this committee ways to support our community partners, but that's just the piece that seems really important too. And I just am wondering, has your committee spent time on that, or might that be covered in this sort of work?
We have spent a lot of time on this issue at other times. I think we all recognize the challenge. And not sure there's a better answer. I think that is reflected in our memo when we say the need for much more robust resources. And I think you included it in your budget. Another step towards that in terms of the mental health budget within healthcare, so that there's adequate recognition that these need to be addressed equally in terms of ability to recruit and retain staff. So it is a big issue. It's a big part of this, but I don't think we wanted to see that challenge as something we had to resolve before we move forward on this really critical piece.
Yeah, no, understood. Thank you again to all of you who've worked on this.
Thank you, Kimberly. Bill, welcome. You popped in while we were in the middle, so welcome, and we'd love to hear your thoughts.
Well, I just, again, I'm going to salute Representative Donahue for her tremendous leadership in our committee around this, both in organizing the testimony. I think the fact that we took 3 days of testimony really informed greatly our recommendation. But I wanted to just chime in to say in response to Kimberly's comments and question that the testimony that we've also received is that the DAs are fully in support of moving forward with this initiative, so that they're prepared to continue to meet the challenge, even with what we all understand are the broader challenges of recruitment, et cetera. But the DAs are willing and eager partners in this initiative.
Thank you, Bill. Are there any other questions or comments that members would like to make? If not, this is an important piece of legislation that's in our budget, an important policy, and these make the needed adjustments. Is there I would entertain the motion to, would someone like to make a motion?
I would love to make a motion, Madam Chair. I would like to make a motion that we report favorably on the amendment presented by Representative Ann Donahue to H969.
Thank you,
Second.
Diane. Is there a second?
Second.
Thank you, Peter. So the motion has been made and seconded to accept the amendment by Representative Donahue. Are there any final comments or questions? Bill?
Well, I'm sorry, I'm interrupting your voting process, but I think I should, as the chair of the House Healthcare Committee, say that while we did not, because of the late hour, which we finalized all our work, but we did not take a formal vote in our committee, but I think it's really strongly understood that there's a very strong support from our committee, and I'd say a broad consensus. And if we polled our committee, which we will do before the floor, so that we can report that to the floor, I think we will find that it's a unanimous support.
Thank you for that clarification. Mary?
Kitty, yeah, thank you. I just want to add my profound thanks to the committee for really stepping up and doing a lot of hard work in the past week to produce yet the next step in the work that we're doing in this area. It's just really spectacular, Bill and Ann. So thank you. And if you'll just tell me the results of the poll of your group, since I'll be reporting this portion, I'll report it briefly and then hand it over to Ann for any questions. So thank you.
Thank you. Actually, Mary, you'll report out the appropriation, but Ann will actually report her own amendment.
Yeah, good point.
Okay.
Yeah,
Okay.
yeah.
Any other final thoughts or questions? If not, would the clerk please call the roll?
Thank you, Madam Chair. Representative Conquest,
Yes.
Representative Fagan,
Yes.
Representative Feltus,
Yes.
Representative Helm,
Yes.
Representative Hooper,
Yes.
Representative Jessup,
Yes.
Representative Lanfer, yes. Representative Myers,
Yes.
Representative Townsend,
Yes.
Representative Yakavoni,
Yes.
Representative Toll.
Yes.
That's Mary, that's 11-0-0 in favor.
Thank you. And Mary, you'll report that. And Ann and Bill, thank you for joining us and thank you for your work and getting this amendment to us and making this final step.
Thank you very much.
Thank you.
So we are going to move on to back to another amendment. You're both welcome to stay, or if you want to zoom out, you're welcome to do that as well. But we have Representative Higley back with us. Do we have your amendment now, Mark?
Representative,
Yes, you should.
did you approve the amendment that Chrissy sent you? Are you okay?
I did, yeah. I just got it about 5 minutes ago and I emailed back and said that's what I was looking for and thank you.
Okay, I'm gonna get it ready for the screen then.
And Mark, you're walking through this and not legislative council?
Yes.
Okay.
Actually, Joint Fiscal drafted it for him.
Yeah, I talked to Luke this morning and he said JFO would be the ones drafting it, so.
Sorry, it's giving me a hard time. I had too many things up on my screen. Right here. Oh, what happened? Oh, it's on the wrong side. Oh, you never know what this computer's gonna do this morning.
I don't know.
There we go.
Yeah.
Okay. All right, Mark. I think this is pretty easy, but I'll let you introduce it to the committee.
It is, again, Representative Mark Higley, amendment on H 969, basically looking to strike that section B 1105. And if you could just scroll down a little bit to the next line, I believe it just states as deleted. So the new text, I believe, in the bill would say that section B 1105 deleted. I saw
Right.
that on my email, so I don't know if it needs to be in there, but that's basically what it does.
It's there.
Okay.
No, it doesn't say, I don't see where it says deleted.
It's
This
just,
in its entirety, what he said, he saw actually in the bill, it's going to say section B 105 dash deleted. And
Right,
that's,
that's what I saw in my email anyway, and I don't know if it makes a difference. It's up to you folks. But
no,
that's
this
what I,
strikes it. Yeah. This strikes it in its entirety, Mark. So
okay, yep, thank you.
can we go back to the full screen, Teresa? Are there questions for Mark? Now that we do have an official amendment in front of us, I would entertain a motion. Representative Lamfer?
Here, I am here. Representative Lamfer, Representative Toll. I'd like to make a motion that we report favorably on the amendment presented by Representative Mark Higley.
Okay, is there a second?
I'll second that.
And the motion is seconded by Representative Iacovoni. Are there any final questions or concerns or thoughts? If not, the clerk shall call the roll.
Representative Conquest,
Yes.
Representative Fagan,
Yes.
Representative Feltus,
Yes.
Representative Helm,
Oh, yes.
Representative Hooper,
Yes.
Representative Jessup,
Yes.
Representative Lamfer, yes. Representative Myers,
Yes.
Representative Townsend,
Yes.
Representative Iacovoni,
Yes.
Representative Toll.
Yes,
I'm assuming Representative Iacovoni will be reporting this, or
yes,
Maybe I'm-
yes. Dave, you'll report out the vote of our committee.
which is 11-0-0.
You bet.
Okay. Thank you, Mark, for bringing this in, and we will see you on the floor at 2 o'clock.
Okay, and thank you very much, committee, for your consideration.
You're welcome. And Dave, you'll be prepared to provide the Appropriations Committee vote on the floor, right? This is your section. We remember well, this is your
Yes.
section, Dave. Okay,
Can I get a
So-
copy of that, of the amendment, Teresa, when you get a chance? So I can put it with the paperwork?
I will send it to everybody, yes.
I do not believe that we have any other business. I don't believe we need to meet on Monday because the budget will hopefully be voted out today and on its way to the Senate. And so I think we'll have a check-in on Tuesday morning. Teresa?
So I think there might be the joint
Monday at 5 is the judicial retention.
retention on Monday.
Okay.
Yeah, just a
Don't
reminder.
forget to go to your mailboxes and get that ballot. I still
I
haven't.
got, yeah, came in the mail, yep.
Those
Linda?
of us who live in a city just have it delivered to our houses.
And then do we mail the ballot back? Is that what we do? We
After
actually
next,
back.
after next week,
Yes.
after the
After
report.
Monday,
After
right?
Monday, we mail it back in. Thank you.
After
Lynn,
Monday.
Your hand up for something else?
No,
Okay, I
I
think
was
we
gonna
can,
say that I got mine in the mail yesterday too, so.
Ready to go off live?
think we're ready to go offline.